I'm Dr. Scott Thompson. I'm one of the facial plastic surgeons here at Utah Facial Plastics, along with Dr. Manning and Dr. Henstrom. And I just wanted to introduce myself before your consultation. First thing you might notice when I walk in the room is I'm really tall. That's probably the first thing I always hear from people is, wow, you're a lot taller than I saw in your pictures or what I expected. Before you come in the room, we'll give you some paperwork to fill out. There'll be some information asking about your medical history. Sometimes that's done online, sometimes it'll be done in the office, and then one of our medical assistants will put you in the room and ask you a few questions, and then I'll be coming in the room shortly thereafter, usually with one other person. And at that point, that's your opportunity to tell me what your concerns are, or what you're here in our office for. A lot of times people are just noticing that things are happening over time with their face. They're noticing changes in their face or in their eyes that they hadn't ever noticed before, and that are maybe making them look tired or making them look a little bit older. And so those are things that we'll be able to talk about during your visit. And we'll kind of go through all the issues that you have, or all the concerns that you have dealing with your face. We only work from the face, the neck up in our practice, and depending on what your concerns are, that's going to dictate what we talk about and what my recommendations are. And I may be recommending something non-surgical. Even though I'm a surgeon, sometimes we'll talk about non-surgical options. Maybe I don't think there's anything that will really benefit you surgically. Or sometimes I'll be actually recommending something fairly involved surgically, where we'll be lifting the face or lifting the neck and tightening things up. And all of those things, we'll be discussing those procedures in detail, what to expect from them, recovery time, and all the questions that you may have. And that's our initial consultation. And then at the completion of that, one of our patient coordinators will come in. They'll go through a quote with you. They'll talk about schedule, options for when we might be able to do something if you're interested in proceeding. And occasionally somebody wants to come back and do another visit, even though we've had a consultation, and we can certainly do that if the questions aren't answered or if there's confusion. But my goal is to just help guide you through the process of finding out what options you have for the concerns that there are, and helping to give you an idea of something that might be beneficial for you. And it may be something really small, or it might be more involved, depending on what your goals are and where we are. And then ultimately, if you decide, I think I want to do something, and it ends up being surgical, then we'll have another visit called a pre-op visit, where we'll talk about more detail about what to expect after surgery and how to take care of things. But I look forward to having you come in and meeting you, and are developing a relationship together.